We're live. Hello, it's Bill, the knee pain guru. Welcome to the Ask Dr. Beck show with Dr. Beck. Good morning, Charlie. How are you?
Morning, Bill. I'm doing all right.
Okay, good. We skipped last week. We had, scheduling conflicts and.
Yeah, I got called into work.
Yeah?
Yeah.
Called into work.
Well, yeah. I got a family that literally flies in from the left coast to all get treated, and then they go back home the same day. So,
wow.
Yeah.
That's a pretty big deal. You must be a pretty big deal around there.
Maybe.
Well, cool. Anything new and interesting in your practice? Anything then coming up?
Still seeing a lot of shock in patients.
Shock. Is it more recent or longer lasting, or what's the?
I'm not sure how to answer your question. Mostly because shock is not something that we were taught to look for in osteopathic school. I mean, hypovolemic shock, cardiogenic shock, we were taught to look for the things you would do in emergency room. But after you get out of the emergency room, the effects that it has on the body, we're not taught to look for. And so now that I am aware of it, and I've been aware of it for the last year and a half, the more you find, the more subtlety you see, and then the more you find after that, and then the more subtlety you see, and the more you find. So, lots of shock.
How does it show up? Like a person who would have, excuse me, if a person would have experienced shock, or what would be the symptoms that they would be displaying?
Hard. You're asking a question with almost no answer because the answers are limitless.
So broad.
So, from a physical standpoint, it shows up from under my hands in some very distinct patterns. But as far as symptoms, you could feel normal. Now, those around you may see something different, but you inside your own body feel normal. You tend to have a quicker trigger. Your body isn't able to adapt as quickly to environmental changes and life changes. You tend to get more rigid in your personality. So people might see you as more controlling. And that's the big broad category. It can wind up being aches and pains. Mm-hmm. But from a physical standpoint, we talk about the body moving in planes of motion. And there's the plane where the body will flex forward and extend. That is one plane that can be stuck in shock. The body will bend sideways in one direction or sideways in another direction. That's another way the body can be stuck in shock. And then the body will rotate. That's a third way that the body can be stuck. And in some people, all three are stuck. In some, it's one or two. And then you can also have the abdomen that gets stuck. Basically, the solar plexus gets overwhelmed. The peritoneum tightens. You can't really push in and palpate the organs. After you've been doing it for a while, you pick up on the subtlety of the difference. And the lumbar spine, which is comprised of 5 vertebrae, moves like it's one vertebra that's been completely fused together.
Wow. Oh.
Yeah.
A lot of different ways.
And most of the time when these people come into my office, if they say, hey, I've been to see more than, we'll set the number at 2 or 3 competent practitioners. And it doesn't matter what specialty. And no one's been able to figure me out or help me get better. Shock for me is usually number 1 because it seems to keep the things that good-hearted people try to do to help you from working.
Mm-hmm. So it almost seems like that practitioner isn't helping them when in actuality it's like this buffer, this shock is in the front of their ability.
Yes.
Um, and what is the approach to releasing or relaxing it? Is it a indirect approach that you're doing, or is it a vibrational thing? Well, I guess the matching indirectly would be a vibrational thing. Um,
I think it depends on the patient. Sometimes I use a gentle direct technique or application method, and sometimes it's indirect, and sometimes it's quick in that it takes 3 seconds.
mhm.
Sometimes it takes tens of minutes.
Huh. Okay. Yeah, I'm following you. It's been interesting. I've been scar tissue between my shoulder blade, right shoulder blade, and my spine,
Okay.
and old pattern. Shoulder was pulled out when I was 3, so
Okay.
it's been there a minute. And I've been working out on the Pravilo here at the house.
Yep.
Um, and then after that, I had a buddy that's coming over. He's a Sistema guy, and what he would do, we would walk on the back, on the body, just to kind of relax it.
Okay.
And he's a rather substantial person,
Got it.
250, and he will stand right on that spot where the scar tissue is. And what I've been doing is breathing to
Sure.
actively move my nervous system into a parasympathetic state, and then moving underneath that weight.
Okay.
What I've been finding is layers of tension that the body has been adjusting, like vertebrae and things that are able to click back into place
Hmm.
as a result of stabilizing in the direct pressure on the scar tissue that's between the shoulder blade and the vertebrae.
Yeah.
That's been trippy, because the layers that have been happening, because between those standing and that direct pressure, I've been doing indirect stuff to release tension in the rib cage and subtle layers of tension in the scar tissue as well.
Okay.
Anyhow, it's just been super cool to kind of see how the body does a little bit of a cat and mouse game, in terms of it won't move unless you go and then work with it. And then other times you need to totally flow with it to release the pattern.
Yes.
Anyhow, that
Cool stuff.
yeah, it is. It's super cool. Well, cool. Well, thanks for sharing about shock.
Yeah, absolutely.
That was neat. Let's see. I'm looking at questions here. Lumbars. Okay, we covered that last week about spinal stenosis.
Yep.
Let's see. Okay. And there was a couple that came in via email. Here we are. Okay. One was around. It was a blog post we have on the foundation's website, the simplest exercise for lower back pain. And we got some feedback from Anne that said it worked. Wow, feels better. More movement. Thank you. So that was the psoas release with
Okay.
pillows underneath the knees.
Sure.
Okay, question here from Tracy. It says, I have major tightness on my right lower side of neck. I can feel a difference with these exercises with the neck. It's not completely gone, but I have some relief. So these were the body reflex hacking series that we did on neck tension.
Okay.
So is there any suggestion you might have for Tracy to continue to increase the relief in the neck, lower part of the neck?
Okay, so right side, more toward the back.
Lower side of the neck. Yeah.
Yeah, that's going to roughly narrow it down to two muscles, either the levator scapula or the trapezius muscle.
Should we
And
get a? Do you want me to do a screen share here of?
sure, let me.
I could. Let me
If
see.
you look it up and screen share it, and then I can talk people through what's going on with it.
Lower neck pages. Lower neck anatomy. Neck. Y. Let's see if this will work.
Okay.
Okay, share my screen. And here we are. How's this?
Perfect.
We got the right side of the neck.
Got the right side of the neck. Trapezius muscle right there. Now, the trapezius is named because it is trapezoid shaped. It goes from the base of the skull out to the shoulder and then down into the thoracic spine. Because of that, we kind of divide the muscle into four pieces. There's upper left, upper right, lower left, lower right.
Okay.
So we're talking about the upper pieces. They attach from the head at that place there called the external occipital protuberance, right in the center of the head in the back.
Uh-huh.
Yeah, right there. Basically, that's part of the triangle that makes up the trapezoid shape.
Mm-hmm.
So if we think about the trapezius muscle, you can see how its fibers attach all the way along the neck and going out to the shoulder.
Mm-hmm.
It's in the back. It's the most posterior or furthest back muscle in that section of the body.
Mm-hmm.
And so one of the things that you can do to relax it is to stabilize the head. And you can do that with your left hand.
Mm-hmm.
So working on the right side, left hand is going to come up basically on top of the head and just very gently keep the head from moving. Everything I'm going to describe, exactly, you're right. Yep. Going to look like a monkey. Then what you're going to do is you want to stretch that right shoulder just a little bit. So you're going to grab something that doesn't move, table, counter, doesn't matter, and use about 10% of your force to pull down and very slightly away from the body. And that's going to stretch that trapezius muscle. You're going to hold that force for about 30 seconds.
Is this what you're talking about?
Yeah, but you keep your head straight.
Oh, okay. So it's actually the head straight. I'm stretching with the arm.
Yeah, mostly stretching with the arm.
Yep. Okay, so I would take a couple, maybe a slight or lean away.
Yep, lean away. Lean is perfect.
Okay.
Because we're not trying to use a lot of force. We're not trying to make this quick. This is 10% of your total effort over the course of about 30 seconds. And then all that's going to do is stretch those fibers. Mm-hmm. And if you move your hand in relationship to your body, so you can you make it go, let's see here, if it's in this direction and you move it to this direction or that direction, you're working different fibers in the muscle.
So, I'm not able to see you. I'm totally on the screen share. So you mean pulling from here?
I can see me on mine. I can see both of us over to the side.
Okay.
So yes, we're doing right side. So let's just make sure. So left hand's on top of head. I'm just going to keep my head from moving. And then my right arm is going away from me down, and I've grabbed something with the end of my finger. Okay. If I change the angle of my arm, I am going to change in a small way the fibers that I'm working on in that trapezius muscle.
Got it. Okay.
And so it's just a matter of positioning your whole body so that your arm's at the right angle to put those fibers that are tight under just a little bit of tension. And then you give it 30 seconds, maybe 45. It's not one that you're going to stand there for 10 minutes. The effort in 30 seconds is usually done. And then that's it. It's for all intents and purposes, it's a one and done. That is your treatment for that time. And then you can do that. You could repeat it 3 to 5 times a day until you get complete relief.
Okay. How much or little effect would the first rib be involved in this?
So if we're just going to get very technical and split hairs, if we're talking about trapezius muscle, the trapezius muscle doesn't attach to the first rib. So if we're just talking about trapezius, no effect. But levator scapula, then different story. Scalene muscles, different story, because those share some connections with the first rib. The great thing is that the exercise that I just gave can also help treat first rib dysfunction.
Oh, okay. So that can actually help the first rib find its way back into where it needs to be.
Correct. As well as levator scapula. So this is just about finding the spot that's tight and using very gentle pressure over the course of 30 to 45 seconds.
Okay. So this would be the first rib.
Yep.
In there. And you were also talking about the levator scapula. Okay.
Yep. There we go. Underneath.
Yeah. It's going to be okay.
So it's deep to the trapezius.
Got it. Okay. Can I stop sharing there? Yeah, I think we're good. Well, cool. Those were all the questions that came in from a couple weeks ago.
Okay, good.
That's what we got. In couple of interesting things that I've been playing with, it has been that direct indirect piece, and that's been absolutely fascinating to kind of work with. I've been the stuff that you share here connects a lot of dots and makes so much sense.
Good.
Yeah. Cool. And I believe next week we're going to have some clips that we're going to be able to play in while we're doing
nice.
Video. Yeah, some promo things for donations for the Comella Foundation, as well as the pain sending in questions for here, as well as the pain relief portal, sending that on the website. For those that are online, if you have a question for Dr. Beck, please type that in the comments section. You're welcome to do that at any point in time, as well as if you're watching the replay, please type questions in for Ask Dr. Beck. We'll do it right there. There's the link. It's also going to be in the description box below. You can click on that and enter those in regardless, because we use those, we monitor all those and use those on future shows. So that's all we got.
Cool.
Today.
Short and sweet.
Cool. Okay. Well, Charlie, I thank you so much for your time, your expertise, sharing. Very much appreciated. This is Bill Paravano, the knee pain guru, gonna sign off for today. Have a wonderful day. We will see you next week. Have a great one.
Have a great one, everyone.